Alright, category 3 video. First we're going to start with the Cat 3 psoas. Traction our patient's arms together. See which one? Oh, and it's the left short, so that means we'll treat the left psoas. Come in right by the ASI, so inhale, dig deeper on the exhale, repeat that up to 3 times. For video's sake purposes, I won't demonstrate the whole thing. Arms again, and if the psoas work, the fingers should be even. Next we performed the prone leg length, but you can look back into one of my beginning videos and I already shot that, so you can look back at that for look at it if you want to see. Next we'll do the glute fiber analysis, so if you could lay face down for me please, patient. And it starts at the PSIS as being L5, and then you do a human inch out lateral, both times to L5, L4, L3, L2, L1, going along the iliac crest. And just I'm asking my patient which one's more tender.
One on the right.
And then we differentiate shots. So he said one on the right, and so that'd be L1. And since that's L1, there's a love brother relation to that, and that's C5. So we feel the C5 is TVPs or the spinous. Say TVP, his left TVP was more tender. So that's going to correlate down to the spinous of L1. And then we feel, is the spinous tender? Yikes, alright, sweet. And then now we'll do the indicators. So the indicators, it's the gastrocs, hamstring, glutes, and the TS line. And we check on both sides and we're just feeling for tightness. Some tightness in them, okay. And then the TS line. Alright, now we'll be doing the SOTA. So my patient came in with left leg sciatic pain, and so we'd be bringing out the leg laterally until we see the glutes start to bunch, and then we externally rotate the leg. We hold for 15 seconds. 1, 2, 15, and then we repeat it again. 1, 2, 15, and then we ask the patient how it felt between the first and second test. We do 3 answers. If the pain decreased, it felt better. It's a piriformis problem. If the pain stayed the same, we're thinking of a herniated disc or subluxation. If the pain increased, or if it didn't, the test didn't help, it would be sequestered disc. To continue Cat 3, now we're doing Cat 3 blocking. So the short leg from 45 degrees at the greater trochanter, blocking. And 45 degrees on the long leg at ASIS. Do this for a max 30 minutes, and I would gear or fine tune these to whatever feels good for them. And next we'll move on to block augmentation for the posterior ilioifemoral ligament, which is by noting internal restriction. I'll say it's this one. Let's go to the posterior ilioifemoral. Double thumb. And then impulse towards the opposite greater operator foramen. For the LVD, we're going to do the tenderness of the TPP cervical. Has a lot of correlation with the lumbar on that same lumbar spinous rotation on that same side. And so I'd have them flex the knee up, having them breathe in, inhale, and then pushing lateral to medial. On the inhale for 5 to 10 seconds, and I do that for 5 to 10 seconds. Now for the lymph, the cervical indicator is the spinous process, and that tenderness correlates with the levit of the lumbar mammillaries. And we'll fix it the same way, but we'll push IS on the mammillary on inhalation, and then on exhalation you do that 5 to 10 times. Next we'll do the acetabular goading, so that's only if they have acetabular pain. We'll find and goad in there, and we can pull it out lateral, and then find it and goad out the tenderness, and then medial, find it and goad out the tenderness. Next for the orthopedic blocking, we'll just remove the short leg block.
side of rotation.
We'll remove the block on the side of spinous rotation. We'll do that for 3 to 5 minutes during the category 3 blocking time of 30 minutes, and then we'll just insert it back in after that 3 to 5 minutes is up. And that's to allow the vertebral body that's rotated to slide back into normal position. Next, we'll do sciatic traction, so the leg of sciatic pain. We'll just traction it. Have the patient grab the head of the table. Good job. And then with assisted traction, I'd have my assistant come in and he'd traction the leg for me while I push I to S on the spinous, or on the mammillary, or yeah, the spinous. Thanks for that. Next we'll do sacral base. I shot sacral base in one of my other videos, so if you need to go look at that, you can refer to that other video. For post blocking, we'll do sitting disc, so patient can have me sit up for me. And then sitting disc, and the lumbar level, that's a problem. And have the patient tuck his chin to his chest, put his hands on his knees, and bend over on the inhale. On the inhale, I'm pushing I to S, and he's pushing his lumbar spine against my hand. And on the exhale, I'm pushing P to A. And that's the sitting disc. Now for the side posture, we're going to lay him on the side of the leg of sciatic pain. If it's, there's two other positions. It can either be spinous is down, and that means I'm driving P to A, and then the wedge is up, and that means I'm driving I to S. So I'm doing this, I have him scoot close to the table because we're not trying to rotate the pelvis at all in this. And then I'm just getting the mammillary contact in my pisiform. And both things are the same, it's just my line of drive that's changing. And then we're done, SOT.